Welcome back to Have More Babies. You know, as parents, there are these little milestones, maybe choices that come up. And one that pops up a lot, especially for baby girls, is ear piercing.
Mm-hmm. Definitely.
It might be cultural, maybe just something you like the look of, but almost immediately you start thinking, okay, when and where? Is this safe? What kind of earrings? All those questions flood in.
They really do. It's a common set of concerns.
So today we're going to get into that. We've been looking at some really solid advice from the pediatric pros over at Omega Pediatrics.
Exactly. We've reviewed their guidance, and the idea is really to help you, if this is something you're considering for your baby, understand what's involved. Just giving you the info to make a really informed, safe choice.
Okay, perfect. So let's jump right in. What's the first big thing Omega Pediatrics talks about? Timing seems huge.
It really is key. They recommend waiting until the baby is at least 3 months old.
3 months.
Yeah.
Okay, why is that? Is it just an arbitrary number?
No, not at all. There's a solid medical reason. Omega Pediatrics points out that babies younger than 3 months, well, their immune systems are still developing, so they're more susceptible to infection. And if they do get an infection with a fever at that young age, standard medical practice often means potential hospitalization for tests.
Oh, wow. Okay, so waiting just avoids that whole potential complication.
Precisely, it lowers that specific risk quite significantly.
And didn't they also mention something about vaccinations? Tetanus shots.
Yes, good point. They advise waiting until the baby has had at least 2 tetanus shots. It's just another layer of protection.
Building up those defenses. Makes sense.
And thinking longer term, Omega Pediatrics also notes that waiting until they're a bit older, maybe even a toddler, has its perks.
Like what?
Well, an older child can sort of start to understand and even participate a little in keeping the area clean, like maybe understanding don't touch your ears with sticky fingers.
Huh. Good constant battle. But yeah, I see the point. A little bit of awareness helps.
It definitely can. So yeah, a bit of patience often pays off for a smoother experience.
Okay, so patience on the age. What about the actual day, like when you schedule the appointment? Any tips there from Omega Pediatrics?
Yeah, they have some practical advice on that too. They suggest picking a time when your child is generally happy and alert, trying to get it done when they're already tired or hungry or just generally fussy. Well, it's probably not going to go as well for anyone.
Right, setting yourself up for success.
Exactly. And they do mention that pediatricians are usually pretty good about working around things like feeding schedules to find that optimal time.
That's good to know. Okay, so what if the child is a bit older, like a toddler who understands more? How do you prepare them?
That's where communication comes in, according to Omega Pediatrics. It's kind of like preparing them for a shot, giving them a little heads up about what will happen, explaining it simply, can really reduce the surprise factor and maybe lessen any anxiety.
So they're not just suddenly surprised by a little pinch.
Right. It might even help them feel a bit more in control or cooperative.
And during the piercing itself, I imagine distraction is your best friend.
Oh, absolutely. Omega Pediatrics definitely highlights distraction. While the person doing the piercing is cleaning the ear, marking the spot, having a favorite toy ready, singing a song, maybe even a quick video on your phone, anything to take their mind off the actual procedure can make a big difference.
Good tactics.
Okay.
So we've got timing, preparation. Let's talk about where this happens and the equipment. This feels really crucial for safety.
It is, absolutely. Omega Pediatrics notes that having it done right in the pediatrician's office offers a lot of reassurance. You know you're in a sterile medical environment.
That inherent level of cleanliness.
Exactly. Now, if parents choose, say, a jewelry store, the advice is clear. Pick a reputable place, make sure they use strict sterile practices, and don't be afraid to ask about their procedures.
Right. You should feel comfortable asking how they sterilize things.
Definitely.
Yeah.
And who does the piercing matters just as much as where. Whether it's the pediatrician or a professional piercer, Omega Pediatrics stresses they need proper training, must use disposable gloves for each client, and absolutely have to use thoroughly sterilized tools. And on that note, they issue a really strong warning against using piercing guns on babies.
Okay, piercing guns. You see those everywhere, like at the mall. Why are they a bad idea for babies, according to Omega?
Well, there are several reasons they point out. First is the mechanism itself. Piercing guns use blunt force. They essentially ram a relatively dull stud through the ear tissue.
Oof, that sounds kind of traumatic.
It can cause more tissue damage compared to a clean piercing made with a sharp, sterile needle, and that damage can actually make healing harder. Plus, the studs themselves aren't always ideal. maybe not sharp enough, maybe the post length isn't right for a baby's little earlobe.
Okay, so the method itself isn't great. What else?
The big one is sterilization, or rather, the lack of it. Piercing guns are notoriously hard to sterilize properly between uses. They often have plastic parts that just can't go into an autoclave, which is the medical standard for sterilization using heat and pressure.
So they just get wiped down.
Often, yes. And that carries a real risk of cross-contamination. Think blood-borne pathogens potentially being transferred from one person to the next. Omega Pediatrics specifically mentions that staff at, say, mall kiosks might not have thorough training on blood-borne pathogens and disease transmission, raising concerns about infections like hepatitis.
Wow,
Oh.
that's actually quite scary when you think about it.
It is. So, compared to using a sterile, single-use needle by a trained professional, the gun method carries higher risks of irritation, infection, and just, well, human error.
Okay, message received loud and clear. Avoid the piercing gun for babies. Go for a sterile needle method with a trained professional, ideally a pediatrician.
That's the strong recommendation from Omega Pediatrics, yes.
All right. Now, assuming we've chosen the right place and method, what about the earrings themselves? What should parents look for?
Material is key here. Omega Pediatrics recommends hypoallergenic materials to minimize allergic reactions. Think sterling silver or gold, specifically 14 karat, 18 karat, or even 24 karat gold.
What about nickel? You hear about nickel allergies a lot.
Exactly. They strongly advise against anything containing nickel, as it's a very common culprit for skin reactions, especially in sensitive baby skin. Even hypoallergenic isn't a 100% guarantee, so you still need to watch for any signs of irritation. But starting with nickel-free gold or sterling silver is the best bet.
Okay, hypoallergenic materials. What about the style or shape of the earring for a baby?
For babies, simple and safe is the way to go. Omega Pediatrics suggests small, flat, round earrings, nothing with sharp edges that could poke the baby or catch on clothes or blankets.
Makes sense. And the backs. That seems important too, so they don't fall out.
Very important. You want backs that are secure. Omega Pediatrics recommends locking backs or screw-style backs. They should also cover the end of the post well, so it's not poking the baby behind the ear.
Right. And definitely no dangly earrings, I assume.
Oh, definitely not for babies.
Ah.
Omega Pediatrics advises against anything hanging or dangling. There's just too much risk of the baby grabbing it, causing an injury, or the earring falling off and becoming a choking hazard. Small, flat, secure studs are the way to go.
Got it. Simple, secure, and safe. Now the piercing is done, the right earrings are in. What about aftercare? That seems super important.
Absolutely crucial. It's vital for preventing infection and making sure everything heals well. Omega Pediatrics gives some clear steps. First, expect a little bit of redness, maybe some mild swelling or sensitivity right after. That's pretty normal.
Okay.
The golden rule is always wash your hands thoroughly with soap and water before you touch the baby's ears or the earrings, and generally try to avoid touching them unnecessarily.
Keep curious little fingers and adult fingers away as much as possible.
Exactly. Then, the cleaning routine. They recommend cleaning the front and back of the piercing 2 to 3 times a day. Use a cotton swab dipped in rubbing alcohol or the specific cleaning solution provided by the piercer.
Front and back, a couple times a day. Got it. Anything else during cleaning?
Yeah, after cleaning, gently check that the earring back is still secure. Not too tight, but secure. And they also recommend gently rotating the earrings, maybe a full turn, once a day during cleaning.
Apply to rotation.
It helps prevent the skin from sort of adhering or sticking to the earring post as it heals. Just
Okay,
keeps things moving freely.
Okay. And any things to avoid during healing?
Be careful with things that might pull on the ears, combing hair nearby, putting clothes over the head, even holding a phone close to their ear if they're older. Just be mindful. Omega Pediatrics also advises avoiding soaking the ears in water for long periods during healing, so maybe quick baths instead of long soaks, and avoid swimming pools.
Right, minimizing bacteria exposure. How long does this intense aftercare usually last?
Well, the earrings themselves should not be removed at all for at least 6 weeks straight. Sometimes longer, depending on the piercer's specific advice. Keep them in continuously.
6 weeks minimum. Okay.
And the cleaning routine should continue for that whole 6-week period, maybe even a bit beyond. Consistency is key.
And if the child is older, maybe they can help.
For sure. Omega Pediatrics suggests that if the child is old enough, you can start teaching them how to help with the cleaning, always with adult supervision, of course. Builds good habits. Oh, and one more thing about timing after that initial 6-week or longer healing. They suggest considering keeping post-style earrings in for maybe 6 months total.
6 months. Why so long?
Just to really ensure the holes don't try to close up. Piercings in young children can sometimes close faster than in adults if left empty too soon.
Ah, okay. Good tip. Now, what about problems? What are the warning signs, the red flags parents need to watch out for?
Vigilance is really important, especially in the first day or two. Omega Pediatrics says to watch for any signs of infection. That includes a fever, specifically 100.4 degrees Fahrenheit or 38 degrees Celsius or higher.
Okay, fever's a big one.
Also, increasing redness or swelling around the piercing site if the area feels unusually hot to the touch, or if you see any pus or yellowish discharge. Those are classic infection signs.
Got it. Fever, worsening redness, heat, pus. Anything else?
They also mention a few other, though less common, potential complications to be aware of. Things like the earlobe actually tearing, any kind of deformation, developing thick scars called keloids. Also, allergic reactions that don't clear up, the earring back getting embedded into the skin, which can happen if swelling is severe or the post is too short, or any bleeding that doesn't stop easily.
Okay, so if parents see any of those signs, what's the next step?
Call the doctor or pediatrician right away. Don't wait. It's always best to get it checked out promptly.
Absolutely. Better safe than sorry. Now, you mentioned earlier that Omega Pediatrics themselves offer piercing. Let's touch on the pediatrician's role again.
Right. They make it clear that ear piercing isn't medically necessary. It's cosmetic, it's cultural, it's a choice. But if parents choose to do it, having it done by a pediatrician does offer advantages.
Like the sterile environment we discussed.
Exactly. Reduced risk of infection compared to maybe a retail setting. Plus, the child might just feel more comfortable and less scared with the doctor they already know and trust.
That familiarity factor.
Yeah, but Omega Pediatrics also stresses that no matter who does it, pediatrician or professional piercer, the keys are always proper preparation beforehand and really diligent hygienic aftercare afterwards.
The parent's role is still critical.
Absolutely. And yes, as you mentioned, for families in their service area, Omega Pediatrics does offer ear piercing performed by their medical team.
Which is great info for our listeners in Georgia.
Definitely. If you're in Georgia, they provide that service with experienced medical professionals.
Okay, so let's recap the big takeaways from Omega Pediatrics. If you're considering baby ear piercing, wait until at least 3 months old. Make sure they've had tetanus shots.
Right. Choose a safe place using sterile needles. Absolutely avoid piercing guns.
Pick hypoallergenic earrings, gold or sterling silver, that are small, flat, with secure backs. No dangles.
And follow that aftercare routine. Religiously wash hands, clean twice daily with alcohol, rotate gently, keep them in for at least 6 weeks.
And watch carefully for any signs of infection or other problems, and call the doctor if you see anything concerning.
You've got it. That really covers the core advice.
So for parents listening, especially those in Georgia, if you're looking for a place you can trust for your child's ear piercing, run by medical experts.
And checking out Omega Pediatrics is a really good move. You can find all the details on their website.
That's right. Please do visit omegapediatrics.com. You can learn more about their ear piercing service, their approach, and book an appointment right there.
They really focus on making it a safe and positive experience, leveraging their medical expertise. So omegapediatrics.com is the place to go.
Absolutely. And for everyone listening, if you found this information helpful, please give this video a like.
And subscribe to the channel. That way, you won't miss out on our future conversations about baby and child health.
And share this video with any other parents you know who might be wondering about ear piercing too.
Spread the knowledge.
Exactly. Well, thank you for tuning in to Have More Babies for this look at baby ear piercing, guided by the experts at Omega Pediatrics. Remember, it's your choice, but doing it safely and with the right info is what matters most for your little one. We'll catch you next time.
Bye, everyone.